Okay, so we got our sticks here. We have chest and lung, female GU. We have musculoskeletal, cranial nerves, male GU, breast exams, abdominal, and heart and vascular. So make sure they're all facing down. Mix them up. Fan them out. Which one did you want?
Well, I got heart and vascular and abdominal.
In the bottle.
Okay, so we're gonna do, well, first thing we gather our supplies, which heart and vascular, I'm gonna auscultate, and abdominal, same thing. So I'm gonna use my stethoscope. And for heart and vascular, the first thing I'm gonna check is for the neck. First of all, I'm gonna have my patient laying supine, and I'm gonna inspect the neck, the condition of the skin of the neck, and I'm gonna check for the carotid and the jugular veins, for the pulsations. And I'm also going to palpate, but not both at the same time, just separate, not massaging, not occluding the veins, so one at a time. And I'm checking for the pulsations, the rate, the symmetry, the amplitude, the rhythm, and I'm going to auscultate also. I'm going to use the bell of the stethoscope, and my patient is going to hold her breath. So auscultating this, she's going to hold her breath, and I'm going to check for the sounds of this, see if there's anything abnormal. And so, well, that's for this. And then I move on to the chest, which is where we find the valves. And we're going to start with the aortic valve. This is second intercostal space, and this is left left of the sternal border. This is an S2 sound, also an S2 sound, but I'm sorry, did I say left? It's the right. So the aortic is the right, and this one is the left. Sternal border, second intercostal space, S2 sound, and this one is the pulmonic valve. So we have Erb's point, which is the third intercostal space, left of the sternal border, and this is a S1 and 2 sound. Then we have an S1 sound for the tricuspid valve, and it's also left of the sternal border, but it's the fifth intercostal space. And then mid-clavicular line, which is the mitral valve, fifth intercostal space, S1 sound. And so I'm going to auscultate this, looking for murmurs, and I'm going to do this with both the bell and the diaphragm of the stethoscope. So once those are done, I'm going to check for the rest of the body. I'm going to inspect for, see if there's any presence of edema, check for color, for hair distribution, for like temperature, if there's like one leg hotter than the other one. And I'm going to check for pulses, which there's 8 places for pulses. And the first one we're going to do is the temporal. So I'm going to do this with these 2 fingers. So I'm going to check for temporal, and then radial, brachial, apical, femoral, which is in the inguinal area, the groin, and then popliteal, right behind the knee, then the dorsalis pedis, and then the posterior tibial, which is like the Achilles tendon. So same thing, I'm going to check for rate, rhythm, amplitude, symmetry, quality, and all that. And I'm going to rate this, which is 0 to 4. 0, there's no pulses. 4 is bounding, and normal is 2 in between. If it's less than that, then it's diminished. If it's more, um, well, it's a 3. So, and I'm gonna check for varicosities and the yeah, the manual compression test for varicosities, for valve competence. And so I'm going to check for capillary refill, which is pressing the fingers and checking if it's blanching. And if it's less than 2 seconds, it's normal. More than 2 seconds, it's not normal. That is for that one. Now, edema is another rating that I have to do. If in case there's presence of edema, I go from 0 to 4. 0 is no edema. 4 is pitting, could be pitting edema. And then it's 1 plus, 2 plus, 3 plus, 4 plus. And this rating goes from 2 millimeters, 4 millimeters, 6 millimeters, or 8 millimeters. 2 millimeters just takes a few seconds, and then it goes up, 2, 4, 10 seconds, up to 20 seconds for 4 plus edema to rebound, and it's slowly rebounding. And the last thing I'm going to check is for a skin turgor, which is for adults, I pinch the sternum, and for children, I pinch the abdomen, and that tells me skin turgor. So that is basically it for the chest. I mean, yes, for vascular system and abdominal. I'm going to do the abdominals, and well, first thing, they're going to void, and I'm going to lay in supine. Also, they're going to have a gown on, so I have easier access. They can have their legs slightly flexed, so there's no tension, and for comfort also. And the order of this, I'm going to tell them that it's, well, it's in certain order. The first thing is inspection is from least to more invasive. So we're going to do inspection, auscultation, indirect percussion, and palpation, two different types of palpation. And well, since we're inspecting first, we're going to inspect the abdomen, see if it's distended, check the size, symmetry, the contour. I'm going to check the umbilicus also, if there's any distension there. And they're going to raise the head. If there's any bulge, that can be a hernia. And I'm going to measure that from the umbilicus, measure the girth with the tape measure. And then, well, I'm going to check the rest of the abdomen, see for hair distribution, for size, symmetry, the color, if there's any veins, any scars, any, well, visual veins, if there's any scars, any, I don't know, striae or lesions or anything like that. And well, the umbilicus, also see the position of the umbilicus, the presence, because some people don't have one anymore. So, and if there's any color or anything out of the abnormal, the contour or anything like that. And then that is the inspection. So for auscultation, we have 4 quadrants: right upper, right lower, left upper, left lower. Each quadrant, I'm going to auscultate with the diaphragm of the stethoscope, and I'm going to auscultate for about a minute or so. I mean, if it's, the normal sounds are 5 to 30. If it's less than 5, it's hypoactive. If it's more than 30, it's hyperactive. But if there's no sounds, I have to auscultate each quadrant for at least 5 minutes before I determine that the vowel sounds are absent, and that could be an obstruction or something. But yeah, 5 minutes. So, and then we're going to do the percussion, indirect percussion, which is with the fingers. This percussion is to check for any sounds which might indicate the size if they're enlarged, for example, dullness for the liver, and I'm going to check for the spleen and the bladder also if there's any distension, and what is the sound that I'm getting with the indirect percussion. And then palpation, which is, I'm going to start with the light palpation, which is 1 to 2 centimeters. And what I'm checking is the organs, like if the superficial or the surface of the organs, see what characteristics, if there's any masses or anything out of the normal that I can palpate, the size and the tension of the muscle. This is with the light palpation, 1 to 2 centimeters, and I palpate in a rotating motion. But for deeper palpation, I'm going to do the liver is the first one on the right hand side. So I'm going to place my hand on the back of the patient, pushing up a little bit and the costal margin. And then with my hand like this, the patient is going to inhale first and then exhale. And when they create that space, that's when I go in and I palpate as deep as I can. I'm checking for Murphy's sign, see if there's any pain, any tenderness. And so this is on the right hand side. On the left hand side is the spleen, what I'm palpating. And same thing, place my hand in the back, pushing upwards if needed, and then they inhale and then exhale, and then that's when I palpate this way for the um, costal margin, going in, checking for the spleen, any enlargement. And that's it for those two systems.